Morning everyone. Thanks Rod. Rod's my biggest fan apparently. So this morning I'm just going to have a quick chat to you about why aren't I losing weight on LCHF, which is a common theme that I get in my consults from day to day. So by no means is this meant to be a scientific talk. I'm not going to go into the depths of biochemistry. I'm not going to go through scientific papers and comparing diets. I'm just going to have a bit of a chat, talk about some of my observations and see if we can shed some light for some people who are having a little bit of trouble with their weight. So the real question at the start of this talk that I want all of you to consider is, what actually is LCHF? You know, we know what the words stand for, low carb, high fat, but what does that actually mean to everyone? Everyone's got their own definition of what low carb, high fat is. Some people have certain foods that are allowed, certain foods that aren't allowed, certain percentages of carbohydrates, certain grams of carbs, etc., etc. But to me, really, LCHF, or whatever label you want to put on it, really entails more than that. It's about going back to eating, and you keep hearing this over and over, eating real food, just going back to basics, eating food that probably is aligned with our evolutionary background, and compared to the average diet out there or the average nutrition template there is, it inherently becomes a lower carb and higher fat diet than the standard diet. So I think that's probably one of the most important things to remember when we talk about LCHF, and really focusing on the quality of the food, the nutrient density, and all the micronutrients that are going to do you good. So for me, I have my own template of what LCHF is for myself. It might be different from some of the patients I see. It all depends on medical problems, illnesses, goals. There's so many factors that are involved that you can't really say LCHF, this is the one diet. It's more of a template. For myself, I know there's certain foods that I don't like to eat or I don't tolerate well, and basically a lot of them are the processed carbohydrates, grains, polyunsaturated omega-6 fats, and a lot of wheat, gluten-based products. And for me, my LCHF diet has evolved and changed and varied over time depending on what I'm doing in life. So that's what I want to start with talking about, and just some lessons from the past. We've all seen the food pyramid. I'm not going to talk about the politics and the science behind how this came about. I think a lot of us are aware of it. So, many years ago, wrongly or rightly, these guidelines came out and we were told to stick to these guidelines. And yes, there's many faults with the food pyramid, particularly having so many grain-based carbohydrates at the bottom. But what happened next was probably more startling and more interesting to me. Is the food pyramid evolved into what you see on the right-hand side, which is the food industry and business and people gravitating towards products that are low fat. So saturated fat initially in the food pyramid we were told was something we should stay away from, and from that the message morphed into all fat is bad, and from there it turned into a message of don't eat fat at all for optimal health, and it all became about fat-free products. So we could have our cake and eat it too, and who hasn't had an experience in the past where they specifically went for the fat-free product, and then you had the rise of all these products through there. So bearing that in mind, the other lessons from the past are when people using the low-fat diet or the calorie-reduced diet came to their doctor or their dietitian or someone and said, look, it's just not working for me, I'm not losing weight, what am I doing wrong? Straight away they were told that obviously you must be doing it wrong. I mean, the message is simple, it's clear, you're doing it wrong, it's something that you're doing wrong. So, people in the world of business, important things are to have the right business plan and how to implement that properly. So when the whole era of losing weight through the low-fat diet was in the prominence, it was all about the patient or the person doing it wrong. So we know the concept's right, the strategy is right, they must be doing it wrong. So that's just something to bear in mind as well. So not all fat and not all carbs are the same. So it's very easy to get simplistic about LCHF and say, you know, obviously low carb, high fat means carbs are bad, fat's good, and you can get a simplified message there. So there's a big differences between certain types of fat, and particularly the rise of the polyunsaturated omega-6 fats in our oils and processed foods is a big problem. So on the face value, someone might hear LCHF, get the wrong message and think, oh, it's eat fat, and you know, it's about eating the right fats as well. And certainly the same can be said with carbs. I mean, we don't want to do what happened 30 or 40 years ago when the message got turned into all fat is bad, into all carb is bad. It's more about the quality of carbohydrates, I think. I think if we get rid of the processed carbs, then inherently we'll be eating a lot less carbohydrates, and it'll be carbohydrates in good quality. So vegetables, fruit, root tubers, those sort of cellular carbohydrates are probably the important ones. And you can vary the amount you want depending on what your goals are and what your health is already at. So if you're a diabetic with a lot of problems, then yes, certainly would restrict a lot of your carbohydrates. But if you're young and you're metabolically well and you don't have any major problems, then being metabolically flexible is probably important too, and you could probably tolerate and thrive on a little bit more amount of carbohydrates. But certainly compared to the average diet out there, it does become a low carb, high fat diet. So, and some of the worries that I have is the future directions with some of these things. So just as things happened 40 years ago with the food pyramid and fat as being bad morphed into the rise of the fat-free products, I worry that can happen the same way with the carbs. It can be, you know, have your Carb Smart ice cream or have your Choc Honey low carbohydrate bar, and then again, the message at the start of nutrient density, real food goes out the window. So that's just something to consider. So anyway, let's talk about some of our weight loss stalls and where we can make some modifications. So before I do that, there's so much diversity between us, and I like this slide because this is a picture of female athletes, and you can see there's no one quintessential body type that summarizes what an athlete is, and that can basically, you know, be extrapolated for the general person as well. And you can see here all the multiple body types there are out there. So bear that in mind, that we're all individuals and there is diversity, and with that, there's no exactly one diet fits all. So what's the motivation for our weight loss? Is it to be healthy? Or is it, if you're a man, to look like Ryan Gosling, and if you're a woman, to lose weight and get Ryan Gosling? But it's important to think about what the weight loss motive is, and I think having the motive to be good health and prosperity is probably the most important thing, rather than the aesthetics of it. But let's be realistic. Most of us would say, I want to lose weight because I want to look good. But we'll get to that. So what are some of the reasons why we're not losing weight on LCHF? So of course, first and most obvious one is perhaps we're not lowering our carb intake low enough. And again, this goes back to what our state is, what our metabolic state is when we start our weight loss journey on an LCHF diet. Have we done years and years of damage and become so dysregulated that even the slightest amount of carbohydrates causes great problems? And this is a graph that I've stole from Volek and Finney that talks about different levels of insulin resistance and how much they really have to restrict their carbohydrates to get to a decent amount of weight loss. And again, I'll stress it's not just that number. Is it 50 grams of carbohydrates or 25 grams or 100 grams or whatever it is? Again, it's important what that carbohydrate is. Is there a difference between a slice of bread and a big salad with a lot of vegetables and other carbohydrates and a food? Of course there is. So it's always important to think about that as well. So of course we may not be lowering our carbohydrate intake low enough to become metabolically flexible, so we can get stuck in no man's land where we're not really adapted enough to fat and we're not adapted enough to carbohydrates. So that's one of the issues. And also, if we're engaging in high intensity exercise and we're not that metabolically dysregulated, then sometimes going really, really low carb can be a bit detrimental as well. So if you're doing regular high intensity exercise, you probably do want amount of good quality carbohydrate around the time of exercise, just to keep things going well. And that doesn't have to be a huge amount. A little bit of confusion with ketosis. Now, I'm a big advocate of, those that know me, I'm a big advocate of the ketogenic diet and ketosis in the right setting and for the right individual. And I've spent, a lot of the last few years in sort of what you'd call light ketosis or even deeper ketosis. But sometimes people get the message a little bit confused, and I think when it comes to weight loss, and I'm talking about weight loss, not talking about going on a ketogenic diet for neurological problems or as an adjunct to cancer treatment per se, but if you're looking at ketosis purely for weight loss, some people sometimes get fixated with the numbers, and I think the blood readings I'll get, the higher the reading, the more fat I will lose. That's often the case, but there's a little nuance there as well. So the higher the ketone reading, the higher the beta-hydroxybutyrate reading in your blood means the more fat your body is using for fuel and the more ketones you're making from fat. So there has to be a differentiation if you want to lose weight between the fat that you eat and the fat that's stored on your body. Now, initially, when you're trying to go on a ketogenic diet or low carb diet, I suggest, yes, go for unlimited fat to get you into that transition, get you burning fat as your main fuel. But once you're metabolically flexible and once you're fat adapted, you don't need to have as much fat in your diet if you want to allow some of your stored fat to be broken down into ketones. Now, I know it's a subtle point, but sometimes people are triggered more by the number and they think, well, my ketones aren't as high as I want them to be, that means my weight loss is going to stall. It's not necessarily as accurate, as simple as that. But don't get me wrong, I'm a big fan of the ketogenic diet. A lot of us have probably done this in the past. We kind of attempt a low-fat and a low-carb diet at the same time. Yes, this will help you lose weight for a short period. You probably won't sustain it, but you'll end up feeling like crap and you're not really fat adapted and you're not getting enough carbohydrate to supply enough glucose, so you're probably in this constant energy deficit and you don't feel good. And this is another interesting one as well. I mean, sometimes we think that LCHF equals unlimited fat, and that may well be the case, but if you're thinking about weight loss, you have to be sensible about this. I mean, I understand people have spent a lot of time doing low fat and feel like they've been lied to or whatever it is, and now they find out that they can eat fat, and it's not a green light to go crazy and just actually go, I'm just going to rebel and have as much fat as I want. Have as much fat as you need, and realize what the difference between real hunger is and when you're eating just because you can, or you're bored, or you're emotional. So eventually, it may not cause health problems, but if you're eating more fat than you require, you can actually store that. So you may not put on weight, but you're not going to do yourself any favors if you're eating. And I'm talking about really, really large quantities. So if you're having, massive amount of eggs and you're adding more fat, and then you're having a bulletproof coffee, and then you're so concerned that you're not going to get enough fat that you're always adding fat, at the end of the day, it may stall some of your weight loss. So have a think about that as well. Sometimes, and typically in Western society, we often think, more is better. So we know ketosis is good, but so is certain forms of exercise, and so is intermittent fasting and doing sprint training as well. So if I do it all at the same time and do it very often, surely that'll mean that my weight loss will happen faster. Now, we all know with most things in life, it's not always more is better. It's about giving yourself adequate time in between and doing one thing at a time. And if you're going especially for exercise, if you're going from a very low base, give yourself time to adapt to being used to exercise. You don't have to go out there and try and run 100 meters in 12 seconds. Build up to it and give yourself plenty of recovery. If you're not used to high intensity training and you don't have a good base fitness, you're going to need a lot more recovery time for adaptations to actually have a benefit from that exercise. That's where all the good work happens in your recovery, not when you're actually doing your exercise. And sometimes we're a bit too inflexible or too prescriptive. We've read something and we've seen what's worked for one person and said, all right, everyone's got to have 50 grams or whatever you want to say, or eat at this time, or fast every third day, or whatever it is, because it's worked for someone and they stick to it and they stick to it and they stick to it, and it's obviously all working. And I see with a lot of patients, we just play around with things. We have a collaboration, we try different things. If something doesn't work so well, we just fine tune it. So if you get that base right, that real food, the right ingredients, then most of the time it's just fine tuning some of the things in between. And of course, there's going to be other medical issues that may be impacting our weight loss. So there may be other underlying problems, because a lot of us think with weight loss, it's all about carbohydrates and insulin. And yes, I'm not discounting the role of insulin, but there are other hormones. There are other hormonal axes in the bodies. You've got leptin, and obviously there's all other hormones. There's cortisol. There's all other things. So, and then also the thyroid axis as well. So you've got to make sure everything else is right in your health. So certain other medical conditions can cause stalls in our weight loss or weight gain, and certainly medications for other illnesses as well. So it's a matter of going back and reviewing all of these things too. And another important one is actually looking at the individual and looking at what their previous history has been towards their weight. So is this someone who's been on yo-yo diets for 10, 20, 30, 40 years? And I've seen this in the clinic setting, going from one thing to the next, losing weight, putting it back on, really damaging their metabolism. And ironic that it's a Coca-Cola yo-yo, but most of us would probably recognise that from our childhood, as Coca-Cola yo-yos. But that's what happens to a lot of people. They yo-yo diet for many, many years and cause problems to their body, and then they expect going to LCHF and ketogenic diets and everything to get fixed straight away. And sometimes it can take a long time, and you need to be patient and just give it time and go mainly by how you feel and how your health is, rather than what's going on with your weight and the scale. So, of course, 12-week challenges and all these sort of things. I mean, I'm not trying to single out Michelle Bridges, but what happens after 12 weeks? Unless you're alive for 12 weeks and that's your lifespan, that's fine, that's fantastic. But what happens after the 12 weeks? You've done a challenge, you've lost a weight. Simple, continue it on for the rest of your life. And that doesn't happen. The weight goes back on because these are calorie-controlled diets and they're not good for you. And then it goes back to what I said before. You blame the person. You say, well, obviously it worked when you're under my supervision. Now that you're meant to do the 12-week challenge in society, it doesn't work. And it's just like the shows on TV, The Biggest Loser and those. Men and women are different. So, we obviously know that. I thought it'd be a bit risque putting that up there, but don't lynch me afterwards. But men and women are different. We have different physiology. We have different needs and different requirements and different hormones. So, and I see this a lot. I see, often maybe in their 40s or 50s, I see couples coming in to see me, being dragged in by the wife. The husband's going, being dragged along to this weird doctor who's going to make me part of a cult. She spent months and months looking at everything on the internet and reading all the blogs and books and everything, and they both had weight problems, and they've changed their diet to low carb. He's done it because he doesn't want to fight with his wife and it's easier. And he's lost lots of weight, and he's not even as strict, and he doesn't even take it as seriously. And the wife comes in and goes, look, I feel fantastic, my health looks good, my bloods are good, but weight hasn't moved much. This is just crap. Why is he, who sneaks in these Smith chips and all these things occasionally when I'm not around, why has he lost all this weight? And there's no simple answer for that, but there are a few differences between men and women. I mean, generally, I don't have any evidence for this, but these are some of my thoughts. Men obviously generally tend to have more muscle mass. The more muscle mass you have, your requirements of nutrition go up, and basically there's a place for some of that excess glucose and other fuel sources to go to be used. Generally, a lot of men have a worse baseline. They've given up on looking after themselves. Not everyone, but they're like, you know what? I'll I'll be on the seafood diet. I'll seafood and eat it. I don't care. I've got a wife, I've got some kids, I've got a business. It doesn't matter how I look anymore. It's not like I'm going to get Jennifer Hawkins or anyone anyway anymore. So their baseline's not so great. So any changes they make has a far greater impact, where a lot of these women have been trying diets, whether it's low fat or whatever it is. They've had some sort of baseline that's probably better than the average standard Western diet. So they've got a less of a bridge to go. Inherently, women are smaller, and if you look at most species in the animal kingdom, there's a big difference between, and especially in primates, there's a big difference between the female and the male, and it's probably something that we should think about in humans as well. So women are smaller, they probably need more fat on their bodies as well. They probably don't, in terms of portion sizes, and I know I'm not talking about caloric restriction, but in terms of portion sizes, they may not need enough as much as a husband. Now, there are some other theories I have, and there are some smarter people than I that can talk to you about it, like Dr. Ken Sakaris, and issues with uric acid and how that relates to men and women, and differences there as well. And the other thing is, without sounding like a blanket stereotype, women tend to worry about this a lot more. They get a lot of them get, it's got to be all or none. I've got to do it properly. I've got to get all the information. I've got to know exactly everything about LCHF and do it right. I've got to do it right. Got to be in control. And a lot of men are like that too. But some men are like, well, I'll go with the flow. If I lose a few pounds here and there or kilos here and there, it doesn't matter. So there are some differences, and we've got to be mindful of that. Age as well. So if you're a younger person and you're overweight, you're probably going to have more success than someone that's a lot older. And I haven't touched on postmenopausal women and issues with that as well, but you'll find that age is a big factor as well. So if you're someone who's 60 and been overweight for a lot of your life and have a lot of metabolic problems, you're probably going to have to be very careful with what you eat, a bit more strict, a bit more regimented, and just expect that weight loss to happen a bit slower perhaps than someone who's perhaps in their early 20s, is a bit overweight, make some changes, the body will reset itself a little bit faster. And then we'd start delving away from the nutrition aspects of weight loss stalls. So what are our priorities in the psychological and how we manage stress? So a lot of us are probably guilty of this, saying, you know, once I lose weight, everything else will fall into place in life. And that's not true. We all know that. We all know there's going to be challenges in life, often ones that are expected and unexpected and can come at any time. So yes, it's important to take charge of what we eat, our health, and the way we go about our lives, but I don't think it's as simple as, and I've seen patients like this say, I've got a lot of stuff going on in my life, but I've got to fix my nutrition, I've got to eat well, so at least I can get that right. But you know, there's layering of it, so sometimes you've got to go deeper than the nutrition and actually look at some of the psychological problems and challenges that people have and try and address them first. I see a lot of patients, and men and women, but they're successful with work, they have good relationships, they've got happy children, they've got everything that people would say is successful about their lives, yet they're deeply unhappy about their weight, and it's almost like all that other stuff doesn't count anymore because their weight is a problem, and it becomes this sort of thing that eats away at people. And that, you know, we've got people that are afraid of failure, but we also have people that are afraid of success. They don't know what it's like to not have that weight problem a lot of their lives, and you really got to explore some of the psychological aspects of that. And I try and sometimes get patients to address that first before we even worry about their food diary or what they're eating or their macronutrient ratios, etc. So mental health is a very important thing, and it's very tied in with nutrition as well. So how we deal with stress as well is very important. You can't take all the stress away in your life, but you can try and control your response to it. You know, what do you achieve if someone cuts you off in traffic and you start yelling and you know, getting upset and aggressive? It doesn't affect the other person in the car that's done it to you. It just affects yourself. And we've all done it. I've done it. It doesn't have to be road rage or whatever it is, but there's been times where we've had something happen and we've probably responded a bit more than we needed to. And then after you calm down, you think, well, did I really have to put myself through that? And doing that over and over and over, it does cause problems with your weight loss. So I know I'm sort of going away from the nutrition side of things, but I think it's very important to think about those. And another one, I have people that think they're doing all the right things with nutrition, they probably are, but they're up on the internet till 2 in the morning reading about it. And I'm like, well, that's great, fantastic, but go to sleep. Go to bed, get some sleep. And then I hear oh no, I can function on 5 hours, no problems. I go, yes you can, but why should you have to? We're trying to squeeze so much into our lives these days, and particularly for a lot of the people that are very active and pursue sort of endurance sports, you know, you'll have a full-time job, then you'll train before and after, and then you have family commitments and all sorts of other things. And then where do you get downtime? Where do you get your me time from? It's sacrificing sleep. So it's not only about getting enough sleep, it's about when you sleep, it's about the quality of sleep, and trying to live our lives in accordance with our natural circadian rhythms. So you want to get to that optimum sleep point, and I can't say exactly how many hours or what it is, but try and get into a routine, try and get to sleep. Don't sit there in your bed reading your iPhone under cover while your wife or your husband is sleeping. You know, just put the phone on airplane mode, turn it off, put it away. So that's another thing that I often talk about. And appropriate exercise as well. Exercise, you know, we like to say, you know, it's all about nutrition, and that's true. But if you really want to get to your goal weight, you'll have to add in some exercise somewhere. But it's more about general movement and being less sedentary. And I think a lot of people, again, I talked about it before, don't just tackle into a new exercise without having done it before. Build up a base. You know, elite athletes don't rock up to a new season of football or soccer and just say, oh, I've done this sounds good, I don't need to do pre-season, I'm just going to jump in and play my first game. Build it up, build your volume up, get your technique right. Don't go out there and try and do a deadlift of 100 kilos if you've never deadlifted before. You're going to injure yourself. If you're extremely overweight, morbidly obese, you don't need to go running around the tan or go running around jogging. Let some of that weight come off, do something that's non-impact. And build it up slowly, and enjoy your exercise. Make it social, make it fun. Don't see it as punishment, and then see how many benefits, see how many improvements you can make in time. And just going off topic as well a little bit, again talking about weight loss and for the aesthetic reasons. I mean, don't be fooled by what society expects, and don't think that one size, and I know I don't have any pictures of men, I've got women, but if you look at that picture on the left, and most of you would recognise her from the 50s, Marilyn Monroe, it was, you know, 60 years ago, that body type was probably, you know, that was definition. And I'm not saying if you're not that body type, you're not sexy, but back then that was the desired body type, and you know, having some fat for women was in the right places was desired. But a lot of girls these days and a lot of people these days have that misconception that that's still overweight and that's fat. And you can see on the other side, people come in all shapes and sizes, and you know, you have to be comfortable in your own skin. That goes back to the psychology as well. And the one thing I'll also talk about is, for most people, you know, going to LCHF and being mindful of what we put in our mouths is very important, but sometimes there is a small subset of people that have body dysmorphia, and you've got to be very careful how you talk to them about weight loss and weight loss stalls. Losing weight is not about success and failure. It doesn't make you a bad person or a good person. It's not an issue of morality. So if we can get rid of that mindset, we can tackle this very important problem that we have in Western society as well. And it's not just women, it's men as well, who have these disordered views of themselves and are still looking to lose weight. And I've dealt with these patients as well. And that sometimes can be even trickier than those that don't have these issues. So I think that's pretty much it. So just the last slide to end with is, you know, it's a little bit off topic, but be mindful of who you get advice from and who you give advice from, and realise that there's always going to be a lot more that we're going to learn. And don't get scared or frustrated by the fact that you've gone on this journey, you've learned a lot, you think you knew it all, and all of a sudden there's all this other information that's conflicting. You just got to keep going with your journey, looking at things that you can do to maximise your health, looking at things how you can improve your weight loss goals, But if you get the foundation right, if you get the sleep right, if you get the stress management right, interpersonal relationships, and get back to eating real food most of the time that's sustainable. If you're going out to dinner once in a while and there's not something that's LCH friendly on the menu and you don't have any serious medical problems, then don't spend that time stressing about how you're going to deal with that social situation and the food. Just get on with it and make the best choice you can and enjoy the reason you're out, to socialise with people and engage with people, because that's going to be far more beneficial for your overall health and your weight loss goals. So that's just some of my thoughts. Again, take them on board. Don't just take everything I say on face value and as gospel. Question it, think about it, and see how it fits in with your own particular goals as well. Thank you.